Alright, I think I've been recording the most recent video on my iPad, so I just realized in the last video I was holding it too close, so sorry for that. But anyway, I just made a video about stuttering that I'm uploading right now as we speak, so I hope me recording this video doesn't interfere with it uploading to YouTube, but I've had a lot on my mind, and with the holidays are kind of over, so I'm back to making videos. Thank you for the couple of people that have reached out to me regarding future video ideas, and thank you for your recommendations, and thank you for watching my videos, and just be patient as I get back to you. I've had a couple of people email me, which I didn't even know my email was visible on my YouTube, but I don't have any problem with that. Thank you for reaching out. This video, I want to talk about some of the complications of Tourette's syndrome, primarily chronic pain from the repetitive movements. And I mean, I am not speaking offhandedly here. I mean, I have personal experience with chronic pain. I literally have a pain in my neck. I could say Tourette's syndrome is a pain in my neck, because it truly is. I'm looking down because I have some notes on my iPhone that I wrote while I was on public transportation, trying not to focus on my tics, because that is where I have a lot of my anxiety, is in social settings. Hold on a second. Okay. So here's some of the things that I wrote. So much of the experience of Tourette's goes under the radar, even to people with the disorder. I think I often underestimated, especially when I was younger, the impact Tourette's had on my social functioning, as well as overall physical health. Depending on where the tics are in my body, one of the complications from the repetitive movements of Tourette's are sprains, cramps, and muscle tension. These range in severity from simple muscular pain all the way to herniated spinal discs, leading to nerve compression, which I experience as numbness and tingling. I'm just going to pause there and just kind of explain what I wrote. So, as I mentioned in previous videos, there are comorbidities, meaning various other disorders that occur with Tourette's, and these could range from OCD, obsessive compulsive disorder. Well, I almost dropped my phone. Sorry. To depression, anxiety, speech disfluencies, which I mentioned in the video that I'm uploading now. Social anxiety, which I kind of mentioned, and like I said, the complications from the repetitive movements. I mean, there are people, depending on where your tics are, like there are people who clench their teeth, like they grit their teeth so hard that they chip a tooth, or they'll bite their tongue, or they'll self-mutilate. I mean, it's such a varied disorder with a pretty wide spectrum, which is, by the way, why so many people go undiagnosed. But anyway, let me go back to my notes here. Because of my neck tics, or as my neurologist labeled it, and I diagnosed it first, but he confirmed it, I called it cervical myoclonus in my notes, and that's what he said it was. I have a herniated disc in my neck, in the spinal column in my neck. And this was confirmed via MRI in around 2013 or 2014. This injury, like I said, caused numbness and tingling in my left hand. The pain isn't always severe, but occasionally the injury flares up due to my own neck tics, which is the nature of the illness, as well as spontaneously. This week I'm having a flare-up, and it's extremely painful. When did I write this note? I wrote this note on December 23rd, and I mean, this has been going on a lot longer than that. It really sucks. I can't turn my head to the left without excruciating pain. Now, this is true. I mean, I have limited mobility I today, because it's improved, I can touch my left shoulder with my chin, but it still very much hurts. On really severe days, I can't even turn my head to the left without excruciating pain. And I mean, this pain, it's just the worst. I think it's probably one of the worst pains I've ever experienced in my life. And I'm not on any medication for pain or my Tourette's. I should add that. Due to a lapse in insurance and other reasons. But so I'm just reading my notes. Yeah, so the pain, it's a sharp stabbing pain in my left neck. And to make matters worse, I can't permanently stop making the neck movements. Like I said, I mean, it really it's such a variable disorder. I don't really know where my tics are going to be on any given day. I mean, I know I'm going to have facial tics, and I'm going to have neck tics. My tics are basically confined to the upper half of my body. I don't really have leg tics, although I did in my teens. Anyway, but I still have one tic. But I still have tic attached where the neck tic is one of the most prominent features, as well as facial grimacing, like, you know, that, and eye twitches, which, you know, that should be no surprise to people with Tourette's. It's one of the more common symptoms. The tics can definitely wear a person down, both physically, emotionally, and mentally. Now, this is extremely true. It messes with my concentration, and as well as combined with my ADD, which I haven't been officially diagnosed with, but I suspect that I have that. But they're just very distracting, and like I said, it really takes an emotional toll where it limits what you can do in your day depending on how comfortable you feel. And I mean, of course, I'm not saying I don't have free will where I can't go outside if I want to, if I have Tourette's, but like I said, I mean, you don't understand unless you have it how alienating it is to go to a public place and you're having uncontrolled movements, and I mean, people notice. And I know I'm gonna have an encounter where someone's gonna be rude to me, and I don't know if I'm going to know how to handle that. I have in my teens, I have had some really weird encounters with people mocking me for my tics. But anyway, so like I said, the tics can wear you down physically, emotionally, and mentally. It's physically exhausting, suppressing tics and having tics. And okay, so I find them distracting and highly annoying. I covered that. I've tried some medication in the past to varying degrees of success. I can't remember the names, and I mean, this is really for the medical audience if anyone's watching, but I tried Klonopin and Risperidone. I think I'm saying the first name right, but anyway, I tried them at pretty low doses, and I mean, I don't even know if they really helped. I think maybe the Klonopin helped, but the last time I saw my neurologist was in fall 2016. He's a movement disorder specialist here in New York. I don't even know if that alone would identify him. I don't want to drop names, but he's pretty well known. The last time I saw him, so due to a combination of lapses of insurance and inability to self-advocate due to social anxiety and fear of public spaces due to my Tourette's, I haven't gone back on medication yet or sought medical advice. Now that I'm insured, well, kind of insured, I want to try medication again. It's important not to overlook the impact healthy and unhealthy lifestyle choices can have on the expression of Tourette's syndrome. Now, this is important because I feel like a lot of people with Tourette's syndrome may try to self-medicate with drugs. They have addictive tendencies, which can manifest as like drinking a lot of coffee or anything with caffeine, or so anything addictive like that. Or they may make unhealthy food choices just due to the lower tolerance, I mean, lower threshold for impulsivity, meaning that they're impulsive. So, you know, if they walk past a Burger King and they they may not have the impulses to resist that. I mean, of course, you could say that for a lot of people, but I'm saying, at least from my personal experience, I have impulse issues. So I've had problems with excess spending in the past, and you know, impulse purchases, kind of the same thing. But yeah, so there's that. So, and I just kind of gave this, but examples of unhealthy lifestyle choices that can increase tic frequency and depression, anxiety are lack of exercise, excessive coffee, caffeine ingestion. So, yeah, if you're drinking a lot of coffee, you really shouldn't be surprised that you're having severe tics or you're having worse tics. And I do this to myself. I love coffee so much. I love the taste. I love the smell. I mean, who the hell doesn't love coffee? If you don't like coffee, just unsubscribe right now. For the 3 people that are subscribed to my channel. But I did join a gym this year, 2018, in January, and I have seen positive impacts on my health, and it has helped. But when I'm exercising, sometimes my tics will get worse. Really doing anything that is challenging me in terms of exercise, like if I'm lifting a heavy weight or I'm running on a treadmill, which, by the way, I hate. The first time I was on a treadmill, I hated every minute of it, and I've slowly learning to enjoy it, very slowly. But anyway, I have noticed an increase in my neck tics when I'm running, and I'm wondering if I'm eventually, I probably will. I'm eventually gonna have to have probably neurosurgery for my spine to fix the herniated cervical disc, which still causes symptoms to this day because Tourette's is a gift that just keeps giving. Yeah, so those are the end of my notes. But yeah, the chronic pain, I feel like people don't talk about it enough. I mean, it's not just my neck that I've experienced chronic pain with. I would have eye tics where I would like really close my eyes and kind of clench my jaw. I used to have jaw pain. I used to have eye pain. Like a couple months ago when my tics were ocular in nature, I had eye pain a lot. Oddly enough, wearing sunglasses did help decrease tics. I don't know whether it's just due to the tactile nature, meaning I could feel the sunglasses on my face and like it somehow, I don't know, breaks a circuit so like I don't tic. I don't really know what the mechanism is. But yeah, I also just think that having my having my eyes hidden really did help take some of the pressure off me in terms of I could hide a severe blink behind sunglasses, so that's what I did. So that's kind of shady of me, pun intended. It's a sunglasses joke. Anyway, so yeah, so eye pain, neck pain, mental pain. It's just really frustrating, and I want to see more adults making videos about Tourette's syndrome because I feel adults... I mean, I just saw a news article where this woman was 24 years old and she's just getting diagnosed now with Tourette's. Like, it's... I get kind of mad at doctors. And I mean, it's... I don't want to place a blame on the medical profession, but I feel like doctors are sometimes trained to look at severe symptoms, and if your symptoms aren't severe enough, if you're in the mild to moderate, you may be marginalized and you may not be taken seriously. And I definitely feel like that happened to me at least once or twice. But I'm coming up on the 15-minute mark of my video. I would love people to recommend suggestions for my videos, whether they should be shorter or not. I'm always surprised at how much I could talk, or how long and how much I could talk. I hope these videos are informative. I hope they're helping people. And yeah, please comment, subscribe, like this video, and thank you very much.